Hello, I'm Dr. Suddhasattwa Sen, Senior Consultant, Surgical Gastroenterology, GI Oncology, Laparoscopy and Liver Transplant, presently associated with AMRI Dhakuria Hospitals, Ashok Nursing Home in Jodhpur Park and KDQ Center being my chamber. I was a former Senior Consultant with the Fortis Group of Hospitals, Director of Medica and Apollo Group of Hospitals. Pancreas is a very efficient system of enzyme secreting organ which is located in the upper abdomen starting from the right to the left, and it lies in the C loop of the duodenum. Now what are the very sinister problems of pancreas is called the pancreatic cancer, which can be at the head region or at the body tail region. Both of them have different reasons and different treatments. Now normally a pancreatic head cancer, which is more common, the risk factors would be like smoking, there is something called a hereditary pancreatitis and many other factors dependent on the genetic status of the patient. Now the presentation of the pancreatic cancer for the body tail is different. It presents usually with discomfort, pain, or with a very large lump in the abdomen, or it can present with complication like bleeding, etc. when it invades the surrounding organs like colon, stomach or the blood vessels, because it lies very close to the aorta and the inferior vena cava, which are the main blood supply of the abdomen. The head cancers, however, they present mostly with painless jaundice, that is yellowish discoloration of the urine and the eyes, and you may have weight loss, you may have anorexia, that is loss of appetite, you may have back pain, you may have fluctuation of diabetes for the patients who are already diabetic, or there can be a new onset diabetes after specifically the age of 40-45, which is very important to see whether you are having a pancreatic tumor. Now the tumors can vary between 0.5 cm to 5 cm to much larger for the head regions. Now how do we diagnose? We would first get a liver function test done, at the same time ultrasonography, and then probably a CT scan. These would be sufficient to actually diagnose a lesion, that is a tumor in the pancreatic body tail or head, the extent of the tumor that is required for the staging of the tumor. Sometimes we may have to do a specialized endoscopic test called endo-ultrasound plus minus biopsies. These pancreatic adenocarcinomas are specifically solid tumors. Some cases may have a stricture of the bile duct, so we may have to do an MRCP. So once the entire staging of the pancreatic tumor is done, we would embark on something called the queen of all abdominal surgeries, that is a Whipple's procedure. It's a very big procedure, it's a very long procedure, there can be blood loss, there can be substantial ITU, ventilator, etc. support needed. But with more and more experience, we have been doing with very good results, including most of them without any giving blood transfusion or minimal blood loss. And we are not even sending them to an ITU, we would be discharging them very early. Now what happens in this Whipple surgery is we would take out the tumor, the pancreatic head, the entire C loop of the duodenum, part of the stomach, the gallbladder, the bile duct, all the lymphatics, and the 10 cm segment of the small bowel. The portal vein, which is very important, which runs behind the neck of the pancreas, sometimes may also have to be cut out with this specimen if they are involved by the tumor. Now then there comes a very complex reconstruction of making passage once again back for the pancreatic juice, bile, stomach, etc. so that the food can go in and can mix with all the enzymes and have a proper digestion. We some cases needs something called a feeding jejunostomy, where a tube is put in the small bowel for early feeding of the patient, because this patient may be on nothing per mouth for a period of 3 to 5 days. For the body tail tumor, what we would do is a distal pancreatectomy, or what is called a radical distal pancreatectomy, but in this case normally a reconstruction of the pancreas is not required. Now what you have to remember, that a lot of patients of pancreatic cancer may be inoperable, that is, they have spread to the local organs, the blood vessels, or they have spread to liver and other parts of the body. In those cases, sometimes if it is locally advanced, we may have to do something called a triple bypass, that is, make passage with the food pipe to the different organs like the bile duct, the stomach, for the passages of bile and food and other things. Some cases, if there is presence with a very deep jaundice, like the jaundice, different centers have different values, some take at 10, some at 15, some at 20, some do not believe in the values of jaundice. But then usually what is done is, if the jaundice is bit high, then you have to get an ERCP and a stenting done, wait for some time, let the jaundice come down, let the nutrition of the patient improve, and then embark on this big surgery. Now Some of the patients post surgery, when they're successful, may have a sequelae of being on enzyme supplementation. Now, pancreas is also the organ which is responsible for secreting insulin, which controls the sugar level in the body. Now, major dissections of the pancreas may make a certain percentage of patients also diabetic, who may be on a lot of restrictions or insulin or oral hypoglycemics for a substantial period of time.